I want you to imagine, just for a second, that it's the year 2000.
Okay, setting the scene.
Right. So Y2K didn't happen, the world didn't end, and you're standing at the dawn of a new millennium. And the United States has just achieved something that, honestly, sounds like science fiction when you dig into the grim history of human disease.
It really was a monumental moment.
It was. The country officially declares measles completely eliminated from its soil. I mean, we are talking about the single most contagious viral disease known to humanity. A virus that used to infect millions of kids every single year just vanquished within our borders. It's a genuine medical triumph. You could practically hear the champagne corks popping at the CDC.
Yeah, and it's important to clarify what that actually means, right? Because elimination doesn't mean the virus went extinct globally.
Right, it's not like smallpox.
Exactly. It means continuous domestic transmission, like the virus actively passing from person to person within the United States, had been brought to absolute zero. It was the culmination of decades of really systematic grinding public health work.
Zero. That's the key word. Now hold that thought and flash forward. The year is 2025, and that same exact monster comes roaring back.
Roaring back is right.
And we aren't talking about, a handful of travelers bringing it in and it just fizzling out at the airport. We are talking about roughly 2,144 confirmed cases. We're looking at 49 distinct outbreaks spreading across 45 different jurisdictions.
It's massive.
And tragically, 3 deaths, including 2 children. This was the worst year for the disease since the early 1990s. And the thing is, the numbers didn't just magically stop on New Year's Eve. The virus kept climbing right into 2026.
Yeah, the data for 2026 is it's sobering. By early June, the country had already logged around 2,030 additional confirmed cases.
Wow.
And that elimination status we mentioned from the year 2000, that isn't just a ceremonial ribbon, it's a vital epidemiological baseline. Because of this persistent domestic transmission, the U.S. is currently on the very brink of formally losing that status.
Which brings us to our mission today. We are doing a deep dive into a massive dossier that explains exactly how that monster escaped its cage and why the very people in charge of locking it up decided to, well, unbolt the doors.
It's a complex timeline.
Very. The dossier we're looking at is titled The Immunization Retreat and the Future of Public Health. It's actually the finale of a really sweeping historical series called The Rise and Fall of the U.S. Public Health Service. And we're also bringing in raw data from the CDC, the American Academy of Pediatrics, some federal court filings, and reports from the Congressional Research Service.
And I think we need to set some clear ground rules for you right up front.
Yeah, please do.
The events of 2025 and 2026 represent a massive, ongoing structural shift in American public health. This is recent history, it is highly politically charged, and it's deeply contested by very passionate people on all sides. So we're going to navigate this by explicitly distinguishing between documented medical facts and interpretive political framing. We'll examine the strongest, most honest arguments from multiple viewpoints, and we will do so without taking any partisan side.
Right. We're just here to unpack the source material.
Yeah.
And what blows my mind right out of the gate is the sheer speed of this reversal. Going from zero continuous domestic transmission to over 2,000 cases is an absolute shock to the system.
It's unprecedented in modern American history.
And behind those sterile clinical statistics are the frontline medical workers who are actually living through this whiplash. The dossier really centers on the perspective of its compiler, a physician named Nick, who represents the living witnesses to this shift.
Yeah, Nick's career trajectory is really a perfect tragic mirror for this entire era. I mean, you have a medical professional whose long career is completely bracketed by this one disease.
Yeah, it's crazy.
He started his medical training in an era when measles was still an active threat. He worked through the incredible triumphs of the 1990s vaccination campaigns. He was there for the 2000 elimination declaration.
And instead of a quiet retirement where measles is just a dusty chapter in a medical history textbook, he's literally back on the ward. The dossier paints this incredibly vivid picture of what it's like to walk into a pediatric ICU in 2025.
It's visceral.
To see a child covered in that distinct, furious red maculopapular rash, to look inside a kid's mouth and see Koplik spots.
Right, those tiny white lesions on the inner cheek.
Exactly, which is the absolute hallmark of measles. And this is something a whole generation of younger doctors has literally only ever seen in PowerPoint slides.
That's a really important point. We have attending physicians who have never treated a live measles case having to manage outbreaks.
And Nick describes having to sit down with these terrified parents and explain that this virus can cause encephalitis, which is swelling of the brain, or severe pneumonia. It's just gut-wrenching.
It is a profound professional and emotional dislocation. Pediatricians operated for decades under the fundamental assumption that this particular war had been won on American soil.
Right. The settle.
They built their entire clinical approach on that foundation. So to see the virus return is deeply disorienting. They are actively having to relearn how to isolate patients in negative pressure rooms and how to do contact tracing for a disease they were taught was conquered.
It's like, okay, think of it like spending your entire career building a massive, state-of-the-art fire break to protect a vulnerable forest. You pour your blood, sweat, and tears into digging these trenches.
I like this analogy.
You finally retire, feeling secure that the town behind the fire break is safe, and then you immediately have to watch the forest catch fire again, not because of a lightning strike, but because people in the town decided the fire break was an eyesore and started filling it back in.
And to build on that, this particular fire doesn't need much dry brush to become a total inferno. Measles isn't just a run-of-the-mill respiratory infection.
Really not.
To understand why it exploited the weakened fire break so rapidly in 2025, we have to look at the biological mechanics. Epidemiologists use a metric called R0.
Right, the basic reproduction number.
Exactly. It measures how many people, on average, one infected person will pass a virus to in a completely susceptible population.
Let me just put that in perspective for everyone, because the numbers are wild. The seasonal flu usually has an R0 of somewhere between 1 and 2, meaning one person infects 1 or 2 others.
Right.
And the original strain of COVID-19 was somewhere around 2 or 3. So what is the R0 for measles?
Measles has an R0 of 12 to 18.
12 to 18. That is terrifying math.
It is an almost unparalleled level of contagion. I mean, measles is airborne and it lingers. If an infected person walks into a room, coughs, and then leaves, that virus can remain suspended in the air, fully infectious, for up to 2 hours.
Wait, 2 hours after the person is gone?
Yes. If you walk into that empty room 2 hours later and you are unvaccinated, there is a 90% chance you will contract the disease. It is ruthlessly efficient. It basically has a zero margin for error.
So because of that sheer mathematical aggression, the fire break, keeping it out, has to be nearly flawless.
Yeah.
Which brings us to the concept of the herd immunity threshold.
Yes, crucial concept here.
I used to think herd immunity just meant like most people. Like if most of us are vaccinated, we're good. But it's actually a very rigid mathematical boundary, isn't it?
It is entirely rigid. To hold back a disease with an R0 of 12 to 18, you need a near universal vaccination consensus. Specifically, you need about 95% of a community to be fully vaccinated.
95%.
Right. At 95%, the virus simply cannot find enough susceptible hosts to sustain a chain of transmission. It hits dead end after dead end. That 95% is the shield.
And the dossier documents exactly how that shield cracked. We have the data. National MMR coverage, that's the vaccine for measles, mumps, and rubella among kindergartners, fell from about 95.2% in the 2019 to 2020 school year down to roughly 92.7% by the 2023 to 2024 school year.
Which doesn't sound like a lot at first glance.
Exactly. When I first read this, a drop from 95 to 92.7, it sounds like an A-. I thought, hey, we are still getting an A on the test. We should be fine. But then I looked at the actual raw numbers.
The raw numbers are where it gets real.
That tiny 2.5% drop equals roughly 280,000 susceptible kindergartners. Suddenly, it's not a microscopic dip in a national stat. It's the entire population of a small city walking around without armor.
And that sheer scale needs context, because national averages hide local realities. Vaccination rates do not drop uniformly across the 50 states like a slowly receding tide.
Right, it's not evenly spread out.
They drop in clusters. You have certain communities, certain school districts, specific neighborhoods with far lower coverage, sometimes plunging into the 80s or even the 70s. Epidemiologists refer to these localized pockets as thin places in the country's armor.
And the virus doesn't care about the national average, right?
Yep.
It only cares about the room it's currently in.
Precisely. That illustrates the nonlinear nature of infectious disease spread. When you're dealing with a pathogen that demands a 95% threshold, the protection doesn't degrade smoothly.
It's a cliff.
Yes. Once you slip below that 95% line, the shield doesn't just weaken, it shatters entirely for the vulnerable people in that specific cluster. The virus finds those thin places and it moves like a wildfire.
And the devastating outbreaks we saw in 2025 and 2026 were heavily concentrated among unvaccinated kids who fell through those exact mathematical gaps in their local communities.
But we have to look at why those gaps opened up.
Right, because the math, that 95% shield breaking down, it didn't just happen by accident. People didn't just casually forget to go to the doctor. The scaffolding was actively dismantled at the very highest levels of government.
This is where we get into the institutional reordering.
The timeline in this dossier outlining the changes in public health throughout 2025 and 2026 is staggering. Let's unpack this.
So, to understand the full picture, we have to look at Washington, D.C., starting in June of 2025. The Secretary of Health and Human Services took an extraordinary, really unprecedented step.
What did they do?
They removed all 17 sitting members of the Federal Advisory Committee on Immunization Practices, which is widely known as the ACIP.
Okay, we need to pause and explain what the ACIP actually is. Because to a layperson, it sounds like just another boring bureaucratic acronym, but it's really the engine of the whole system, isn't it?
It really is. For decades, the ACIP has been the independent expert panel of medical professionals, pediatricians, virologists, the people who shape the nation's vaccine policy.
They're the ones looking at the actual clinical trials.
Exactly. They look at the trial data and formally recommend which vaccines children and adults should get, at what ages, and in what doses. And crucially, under the Affordable Care Act, an ACIP recommendation carries massive legal weight.
Because of insurance, right?
Yes. It legally triggers a requirement for insurance companies to cover that vaccine at no cost to the patient. So wiping out the entire slate of 17 experts and replacing them with a totally new committee in one fell swoop was an institutional earthquake.
And the newly appointed committee didn't just sit around reading old memos. Over the rest of 2025, they actively revised several major, long-standing public health recommendations.
They did.
And the big phrase that kept coming up in their new guidance was a shift toward shared clinical decision-making. They applied this to the hepatitis B birth dose, which is usually given to newborns right after delivery, and to routine COVID-19 vaccination.
We really need to zero in on that phrase, shared clinical decision-making, because it's a massive philosophical pivot.
How so?
Well, historically, the ACIP issued universal recommendations. The underlying message was, unless there is a specific medical contraindication, every child gets this vaccine. It was a collective baseline.
Right.
Shifting to shared clinical decision-making moves the burden of choice away from a centralized public health authority and drops it directly into the individual exam room.
Wow.
The message becomes, this vaccine is available, and the doctor and the parent should discuss its risks and benefits and decide together if it's right for this specific child.
It turns a standard protocol into a bespoke negotiation for every single patient.
Exactly.
And that was just the warm-up, honestly. Because in January 2026, things escalated even further. A brand new childhood immunization schedule was issued. But this one was formulated entirely outside the usual established ACIP process.
It bypassed the traditional mechanisms of review altogether.
And we can't just look domestically here, because around the same time, the administration executed a massive international withdrawal. Back in January 2025, an executive order was signed to withdraw the United States from the World Health Organization.
The WHO withdrawal, which took formal effect by early 2026, cannot be overstated in its impact on global disease surveillance.
What does that actually look like on the ground?
The WHO operates a vast, interconnected global virosphere. They run surveillance networks that track mutations of influenza in Southeast Asia, they monitor Ebola flare-ups in Africa, and they track the global movement of measles.
And the U.S. was a huge part of that.
Massive. The United States historically provided massive funding, logistical support, and top-tier epidemiological expertise to these networks. Stepping back meant the U.S. was essentially pulling its own radar down. We chose to go blind to the early warning signs of emerging global health threats.
So just to recap the sheer scale of this, we had the ACIP wiped out and replaced, a new alternative schedule issued outside the normal bounds, a shift to shared clinical decision-making, and the U.S. pulling out of the global surveillance network.
It's a comprehensive dismantling of the existing structure.
But then the legal system slammed the brakes. On March 16, 2026, a federal court intervened in a major way.
The legal challenges came fast and hard. They primarily argued violations of the Administrative Procedure Act, claiming the federal government bypassed the legally required steps for making such sweeping policy changes.
And the judge agreed.
The federal judge agreed enough to issue a sweeping stay. They stayed the controversial January schedule, they stayed the appointments of the new ACIP members, and they legally paused the votes made by that new committee.
The legal whiplash is crazy. By issuing that stay, the court essentially forced the old prior immunization schedule back into legal effect.
Right.
So think about where this leaves us in mid-2026. The new rules are paused by a federal judge, meaning the old rules are technically back on the books. But the federal agencies are actively hostile to those old rules, and our international ties with the WHO are actively being severed.
It's chaotic.
Who is actually driving the car right now? It feels less like a planned change in direction and more like someone ripped the steering wheel out mid-drive and just tossed it out the window.
And the dossier highlights this exact chaos, noting that the state of deeply contested, unsettled legal limbo isn't just an accidental byproduct. For many driving these reforms, the disruption is the point.
We wanted to shake the system up.
Exactly. We are looking at a massive system in active renegotiation. The rules are unwritten right now because American society is engaged in a fierce battle over who gets to hold the pen.
And that battle isn't just about bureaucratic red tape in Washington. It is a profound, deeply visceral ideological divide among American parents, doctors, and public health officials.
Which brings us to the core debate of the entire analysis, the fight over trust, authority, and who ultimately gets to decide what is best for a child.
Right, let's get into the honest arguments on both sides. But first, I think we need to set the baseline of science here, just to be absolutely clear.
Yes, before we explore the divide, it is absolutely vital to state the documented, settled medical science. The debate tearing the country apart in 2025 and 2026 is not about the biological efficacy of the vaccines themselves.
It's not a debate about whether the shot works.
No. The medical consensus remains clear and documented. The MMR vaccine is highly effective, measles is a highly dangerous disease, and the vaccine does not cause autism.
Yeah, we have to mention that. The original 1998 paper claiming a link to autism was proven completely fraudulent. The data was manipulated, and the paper was fully retracted by the medical journal that published it.
Exactly. The battle we are examining is entirely about authority and trust. We aren't debating the biology, we are debating the sociology.
So let's look closely at the honest case made by the supporters of these massive 2025 and 2026 changes. The parents and politicians who backed the overhaul of the ACIP and the push for shared clinical decision-making.
They don't view this as a dangerous retreat at all.
No, they view it as a necessary, overdue correction of a system that had grown tyrannical.
Their argument is rooted deeply in the American tradition of individual liberty and parental rights. Supporters argue that the public health establishment had become an overextended, unaccountable technocracy.
Unelected bureaucrats making decisions for everyone.
Right. They believe these moves reassert democratic control over federal agencies that had lost touch with the public.
And let's be real, you have to look at this through the lens of the parents who lived through the COVID-19 pandemic. Think about the whiplash families experience between 2020 and 2024.
It was immense.
You had the school closures that devastated childhood learning, the constantly shifting mask mandates, the heavy-handed pushes for universal pediatric COVID vaccines, even when the risk calculus for young children was very different than for elderly adults.
That is the crux of it. For a huge swath of the population, the pandemic broke their implicit trust in centralized public health messaging.
That loss of trust is the central driver here. To these supporters, prioritizing informed consent and individualized care, that shared clinical decision-making model, is the only way to rebuild a relationship with the medical system.
They want a bespoke medical plan for their child, negotiated with their personal pediatrician, not a blanket mandate handed down from a federal committee in Atlanta.
It's a very powerful desire to reclaim agency.
But the public health critics of these changes present an equally powerful and, frankly, terrifying counter-argument.
Yeah, let's look at the critic side. Because they look at this restructuring and see an active dismantling of the only defense mechanisms we have against mass disease.
The critics warn that by bypassing the traditional, decades-old scientific advisory process, like summarily firing the entire ACIP slate, you heavily politicize what should be objective, empirical medical judgment.
Right, when you turn epidemiology into a partisan loyalty test, the science suffers.
Furthermore, The critics point directly to the brutal statistics we started this deep dive with.
The 2,144 measles cases.
Exactly. The 2025 and 2026 measles resurgence isn't a theoretical model, it's empirical proof. To the public health establishment, those cases and those grieving families are the direct result of eroding the national vaccination consensus.
They argue that dropping the burden of epidemiological expertise squarely onto the shoulders of a tired parent in a pediatrician's waiting room doesn't actually empower the parent.
No, it just leaves the child vulnerable to preventable, tragic diseases. It's asking parents to be virologists.
This is the ultimate, eternal tension of public health, isn't it? The friction between individual autonomy and collective security.
It really is. For over half a century, the system functioned because it relied on an implicit collective trust. Parents largely trusted the structural recommendations of the ACIP, and that collective trust naturally generated the 95% compliance needed for herd immunity.
But once that trust fractured under the immense stress of the pandemic, the consensus inevitably collapsed.
And when the consensus collapses, the 95% shield falls. It's incredibly fragile.
The whole system relies on everybody holding hands, and the minute a few people let go, the barrier breaks.
And to understand how a massive, decades-old federal consensus could just evaporate over a couple of years, the dossier takes a major step back. It forces us to look at the historical fragility of the public health service itself.
This is where the overarching theme of the Rise and Fall series really comes into focus. Let's talk about the history here.
The crisis of 2025 forces a fundamental historical question that reframes this entire narrative. Was the United States Public Health Service ever actually as powerful as its crisp uniforms, its gold seals, and its sweeping federal mandates suggested?
The dossier answers that with a definitive, fascinating no.
No, it wasn't.
The power of the federal public health establishment was always something of an illusion. Or rather, it was incredibly fragile because the power was primarily borrowed and structural.
Let's look at the borrowed part first.
Yeah. The actual miraculous science they relied on was almost always borrowed from outside their own federal halls, right?
Exactly. Think of Edward Jenner discovering the cowpox vaccine for smallpox in late 18th century England, or the groundbreaking germ theories of Robert Koch and Louis Pasteur in Europe.
They didn't invent that in Washington.
No. Even fast-forwarding to the modern era, the mRNA vaccines that altered the course of the COVID-19 pandemic were developed by private pharmaceutical industry partnerships and academic labs. The federal government wasn't in the basement inventing the miracles, they were simply managing the distribution of them.
And the power they did possess was purely structural. They didn't have a standing army of health police. They had an invisible scaffolding of regulations.
The dossier highlights several of these structural pillars.
Let's spend a minute on the Biologics Control Act of 1902, because I think the story behind it perfectly illustrates how federal public health power was built on tragedy, not tyranny.
The 1902 Act is a foundational piece of public health history, and it was born out of a horrific incident in St. Louis involving a horse named Jim.
Tell about Jim.
So Jim was a former milk wagon horse used to produce diphtheria antitoxin. The way they did it back then was they would inject him with the toxin, harvest his blood serum, and use the antibodies to treat children with diphtheria.
Which sounds wild now, but that was cutting-edge medicine.
It was. But Jim contracted tetanus, and a contaminated batch of antitoxin was tragically distributed. 13 children died not from diphtheria, but from the tetanus and the contaminated medicine.
It was a massive national scandal, and it forced the federal government to step in and create the Biologics Control Act, establishing the first real federal oversight over the purity and safety of vaccines and serums.
That is structural power.
Right. We see the same structural approach in the quarantine laws of 1878 and 1893.
Yes, those were driven by devastating yellow fever epidemics that swept up the Mississippi Valley, paralyzing commerce and killing thousands of people.
The federal government stepped in to standardize maritime quarantines because the patchwork of state and local port regulations was totally failing.
Add to that the establishment of basic municipal water standards to fight cholera, or the creation of a rigorously screened national blood supply to fight HIV and hepatitis.
These are massive, invisible systems of rules. They're guardrails, not direct commands to individual citizens.
And when it came to directly influencing public behavior, their power was overwhelmingly moral, not commanded. The dossier focuses heavily on the bully pulpit of the Surgeon General.
Yeah, the Surgeon General's uniform looks like a Navy admiral's, but their real weapon was a microphone.
The history of the Surgeon General is really a history of persuasion. You have Thomas Perrin in the 1930s breaking the radio broadcast ban on even saying the word syphilis out loud.
Which was a huge deal at the time.
It was scandalous, but he forced a puritanical nation to confront a massive public health crisis.
You also have Luther Terry issuing the landmark 1964 Surgeon General's report on smoking and health, linking tobacco to lung cancer. Which, fun fact, they actually released that report on a Saturday morning, so it wouldn't immediately crash the stock market.
That's right. And then you have C. Everett Koop in the 1980s taking the unprecedented step of mailing an informational, deeply controversial brochure about AIDS to every single household in America.
But the key takeaway here is that Perrin, Terry, and Koop couldn't actually force anyone to use a condom or quit smoking. They had to persuade.
That is the crucial distinction that often gets lost in modern political debates. The binding mandates, the actual legal police power to close businesses, mandate vaccines for school entry, or enforce physical quarantines on individuals, have historically lived almost entirely with the states and local municipalities under the 10th Amendment.
We saw that vividly during the 1918 influenza pandemic, where cities like St. Louis closed down while Philadelphia threw a huge parade with wildly different death tolls as a result.
And we saw it play out again in incredibly contentious, litigious ways during the COVID-19 pandemic. The federal public health apparatus could advise, it could fund, and it could build the structural guardrails, but it rarely had the constitutional authority to force compliance.
So when we look back over 2 centuries, the federal public health establishment was never this towering, impenetrable fortress of centralized authority that its critics sometimes fear it is.
No, it was always more like a very convincing, very necessary scaffolding.
It held the framework of society up, it kept the water clean and the medicines pure, but you could always see right through it.
And what we are seeing in 2025 and 2026, with the complete overhaul of the ACIP, the shifting of universal schedules to shared clinical decision-making, the legal chaos in the federal courts, and the withdrawal from the WHO, isn't a mighty fortress being conquered by an invading army.
Right.
It is a fragile scaffolding being deliberately, methodically unbolted by the very people it was built to protect.
The dossier describes the Public Health Service as the stepchild of the federal family.
I think that's a perfect phrase for it.
It was perennially underpowered, frequently underfunded until a crisis hit, and heavily dependent on the borrowed science of others and the legal authority of the states.
Yet, historically, it was the agency that mattered the absolute most when the stakes were existential.
When yellow fever was arriving at the docks, when contaminated medicine was killing kids, or when novel viruses threatened to overwhelm our hospital wards, they were the ones expected to stand guard at the gates.
Which brings us to the ultimate synthesis of this entire deep dive.
Yeah. This dossier is the finale of the rise and fall of the U.S. Public Health Service. But after looking at the devastating measles data from 2025 and understanding the deliberate institutional dismantling of 2026, I don't think this is a story of a traditional rise and fall at all.
I agree.
It is not a melodrama of a great empire collapsing under its own weight. It is something much quieter and, in a way, much more profound. It is the story of a nation deciding in real time exactly how much vigilance it still wants to fund and believe in.
The guard at the gates isn't being violently overthrown. The guard is being told to stand down by choice.
And that deliberate choice leaves us with a profound and, frankly, unsettling historical paradox to consider as we wrap up.
What happens to a society when its public health systems are so incredibly successful that they erase all living memory of the horrors they prevent?
That's the question, isn't it? We built systems that completely hid the devastation of diseases like measles, polio, and diphtheria from modern eyes.
And now, precisely because we no longer remember the terror of those raging fires, we find ourselves debating the necessity of the fire breaks.
When a country forgets the diseases it defeated, perhaps the truest test of its vigilance is whether it will choose to keep its guard up based on the lessons of history, or whether it will wait for the fires to return to our hospital wards before remembering why the fire breaks were built in the first place.
It's something we all need to mull over.
Definitely. Keep your guard up out there.